views and opinions expressed do not necessarily reflect those of Access Fort Wayne, the Allen County Public Library, or any other supporting groups. If you'd like to produce a show, call us at 260-421-1250.
Hi, I'm Dr. Rudy Cashman, neurosurgeon, Fort Wayne, Indiana. Tonight, we're going to have a very interesting discussion about holistic treatment of chronic pain. This is a continuation of a series of 7 or 8 DVDs that we're doing to discuss the treatment of chronic pain. You could call me Dr. Wellness. You could call me Dr. Cashman, the neurosurgeon. Neurosurgeon is my profession, but I'll tell you, wellness is my passion. I have with me tonight 2 guests, Dr. Richard Johnson, who will be speaking to us also, and I also have with me Jacklyn Womble, who is a Pilates instructor, and she'll be explaining to us what Pilates is all about. So let's kind of start on this adventure this evening. And we're going to be talking about the holistic treatment for chronic pain. I'm trying to get away from injections, operations, and narcotics. That's a big one. There's a huge number of addicted people in this country from prescriptions of narcotics for the treatment of chronic pain. It's destroying these people, and this is what I'm trying to avoid. So this is a form of treatment through mind-body techniques, through exercise, and we'll review this in some day. Before we get going on this, I'd like to repeat a little bit from our previous DVDs, our discussion of chronic pain, just to make sure that you understand it, because it's not easy to understand. We have acute pain, okay? What's acute pain? Broken leg, a message gets sent up to your brain, and we put you broke your leg, gives us a message where the problem is, we put a cast on it, give you narcotics maybe for a few weeks, and the darn thing is over. That's fairly simple, very little drug addiction there. But chronic pain is a horse of another color. Chronic pain is pain more than 6 months, and that is the majority of the pain problems. Chronic pain, though, greater than 6 months pain is divided into neuropathic pain. That's where there's been some nerve damage. Your leg is amputated in the war, or a shark bit it off. That's where a nerve has been damaged. And this could be ruptured disc, trigeminal neuralgia, a ruptured bowel. It's some real nerve damage. And that you get a narcotic for a period of time, it's not unusual. But even for that, I don't recommend drugs be used for a long time. And I'll tell you why. It has been shown in pain research that narcotics only help 30% of the people 30% of the time. Wow, Richard, that's a small number, you know.
Oh, that's amazing.
That's amazing. That's a small number. So why would you use narcotics for long-term for them? All you're going to do is sensitize the brain and make addicts out of them. So even for them, it's really not appropriate. That's another 10% of the pain problem, okay? 10% acute, 10% neuropathic. Nociceptive is another form of chronic pain. That's tennis elbow, bursitis, arthritis, and that you treat with arthritic medication, Tylenol, aspirin, a little bit of Ultram perhaps, but you don't need to use narcotics. You might use them for a week or 2, but not long term, because again, narcotics cause sensitization of the brain, and now you have 2 diseases. All you had is bursitis or arthritis, and now you have a chronic pain problem. That's what I'm trying to avoid. But so now we have 50 to 70% of the people, and we don't have a name. So I coined the term, you get a name on something. I read 3 pain books. They don't have a name for them. And they just make up things for them. And I like to call it, say, metabolic pain. I mean, some people call it idiopathic pain. You don't know why they have it. We don't know why you have this pain. It's idiopathic. I mean, what do you think? You're not an idiot. You're not pathetic. I don't like the term, Richard. I don't like it. So I like metabolic. I said it to a psychiatrist, Dr. Snyder at Lufen's. He thought that's a good term. So, but we'll explain this in more detail. Let's go on a little bit. This illustration here, I'd like to have a close look at that. This is something that I put together, and Dr. Snyder, the psychiatrist, thought this was pretty good. So, and this is, remember, acute pain. That's in Buddhist terms is really arrow 1. You notice how small arrow 1 is? It's a small arrow. You break your leg, a message goes up the spinal cord to the cingulate gyrus, and the cingulate gyrus tells you, your leg hurts like heck, I need some morphine, put a cast on it, and I'll feel better. 10% of the pain problem. Let's go the other side of this drawing here now, though, and we have chronic pain, long-term pain, and the people say, I hurt more. The pain could even be worse. The pain could even be worse. And that's chronic pain there is 90% of the pain trouble. But again, we have neuropathic pain is 10%, nociceptive at 10%, and the 50 to 80% of the people have metabolic pain. What does it due to? It's your perception, Richard. It's your perception.
Absolutely.
And it's due to stress, fear, anger, depression, hopelessness. It's your reaction to it. See, pain is one thing, but what you really feel is based really in your life, your past, your future. People generally don't feel just the pain. They dress it up. They can't help it, but that's the situation of it. And that's what we'll be teaching tonight, and you will explain this further. So these patients, this is called arrow 2. See how big this arrow is? A lot bigger. This arrow is a lot bigger. And you see how big this arrow is versus the skinny arrow? And this is called arrow 2 pain. And it's based on your psychology, the chemistry. It's not something you imagine, Richard. It's not something you imagine. It is real. It is real. So let's go on. I think we get some understanding. So, but again, let's sort of use the 2-arrow theory of chronic pain, the small arrow and the big arrow. And but chronic pain, why do we dress it up? Because we don't accept the pure pain. We base it on our stresses of the past, our stresses of the future, our job, our family troubles, got a divorce, lost my job, can't sleep, and we dress it up. And that's called blocking. And blocking can result, when you block the pain, don't look at the pain in its purity, but dress it up. Then you can treat the pain? Food's a drug. Some of us eat because we're hurt. We start overeating because eating secretes serotonin and dopamine. We feel better. Well, we feel better. Food can relieve some pain. And we become restless, can't sleep at night. We feel driven. When I see chronic pain people where it's metabolic pain, they feel driven. You tell them, I don't know why you hurt. They say, but the pain's killing me. Do something, doctor. Anything. They'll lay down for an operation where they don't even need it. And you have to watch that. A lot of chronic pain people lay down for operations based on what I feel is the nocebo effect. What's nocebo? That's the opposite to placebo. Placebo means I will heal. Nocebo is negative talk. This thing on the x-ray is the cause of your problem, but maybe it's not the cause of your problem. But they'll lay down for the operation because the pain is real. The pain is real. They'll use cigarettes, smoking, alcohol, recreational drugs, excessive talking, excessive working. Sometimes wonder myself, I work day and night all the time, write 5 books last year, and you wonder, Rody, what are you doing? Am I dressing up stress? I don't know. You know what I mean? But some people dress it up with narcotics instead of good things. Obviously, I'm doing good things. And we start treating ourselves like we're in the head and not in the body. When things get worse, we start drowning in the pain. We start drowning in the pain. And then we give up. We feel exhaustion. Unpleasant sensations, depression, self-pity, victim mentality. This illustration here really, I think, is very good, and it comes out of a book written by Birch, and I think you've read it. I think it's a very good book. I think this really represents chronic pain. We lose initiative, withdrawal, isolation. We curl up in bed. We don't want to work anymore. Some consider suicide. Some have applied for disability. I can't work anymore. But when I say to the patient, what's the trouble? They say, I hurt. You say, where do you hurt? They can't tell you where they hurt. That's chronic pain that has been dressed up with anxiety and fear. It's arrow 2 pain. And this is very important. So to stick needles in these people and operate on these people is nothing but ridiculous. But to be honest with you, Richard, I see it every day. So I'd like to go into a little bit, how should we treat these patients? With narcotics? No. Injections? No. Pain centers? No. Except rarely. The way I approach them at our Mind Body Institute, number one is I like to know what the pain problem is. They come in to see me. I don't say, where do you hurt? You know my opening words? I had 4 patients like that today in my office. And I say to them, what's going on in your life? Some patients I've learned lately, which has been pretty good, if it's a complex story, I hand them a yellow pad and a pencil. And they write me 30 pages, and then I know what I'm looking at. It's much more likely to make a diagnosis if you know what's going on in that person's life, how they have been dressing up the pain problem, what their anxieties and fears of the future. So I have a pain questionnaire handy that I can look through that's typed out. I like this yellow pad thing. I really like it. I've just started doing that recently, and I've been looking at some amazing stories, And we have, I think, number one treatment really for chronic pain, I think, is mindfulness teaching, to kind of bring you into the present moment and to get rid of the past and the future. And it's mindful, and Richard here is going to speak now a little bit of mindfully based stress reduction. Stress is part of this, is a big part of this, and we teach this at the Mind Body Institute. David Johnson teaches, Richard Johnson teaches it, and it's really, frankly, slowly spreading across the country. A lot of it is based in Canada, a lot of it is based at Harvard University, and you've taken some training there with Kobat Zen. He's written some famous books about this. Richard, could you speak to us a little bit about MBSR, mindfully based stress reduction?
Sure. Well, I got the training with John Kabat-Zinn and others in Worcester, Massachusetts. And I think it's the gold standard of how to deal with stress reduction. It started back in 1979 in a little basement in the hospital. And what they did was they just said, we know in our own lives that meditation, sitting meditation, walking meditation are helpful. But we see all these people streaming into the hospital, and they don't seem to have an approach where the individual person begins to take responsibility for what's going on in their lives. Want to go to a doctor, want to go to somebody who's helpful. You do that once a month, once a year. But if we change ourselves, if we change what's happening inside us, then that's with us all the time. So mindfulness is a way of approaching illness, chronic pain. It's a way of approaching life. What we're doing in mindfulness is we're saying, I'm going to be aware of this moment. I'm going to be aware of my physical sensations, my emotions, my thoughts, what's happening outside me, what's happening inside me. And I'm not going to be on automatic pilot, because automatic pilot leads to stress. The more I am caught in, just getting up in the morning and slogging through life, the more stress I accumulate. And I love the charts that you did about the 2 arrows. Because usually what happens is people get their physical sensations and their emotions and their thoughts all mixed up together. I have a little audio-lingual method here, right here. These are, I don't know if you can see this, but there's the three colors of thread. This is our emotions, here's our thoughts, and here's our body, and they're all mixed up together. And when they're mixed up together, it doesn't work. But when we meditate, we learn to pull them apart. And so we can say, I'm having thoughts. Oh, I'm having emotions. Anyway, I like this. So what we're doing is we're beginning to be able to focus in on what's happening inside us and not get them all bollocksed up. And when we're able to do that, then we can move forward and experience life without being overwhelmed. Being overwhelmed is part of stress reduction, a part of stress reaction. Getting our emotions so hepped up that I'm saying, I'm so angry. Well, I'm not angry. I'm having the emotion of anger. It's not the same as I am angry, So that carefully separating the different things And you mentioned very importantly the past and the future. If I'm in this moment right now, I don't have to be stressed. But if I have things in the past, if I'm reliving the past, or if I'm pre-living the future, oh, tomorrow's going to be terrible, I'm going to have a really hard time. If I live now, I can handle things better. That Birch, Vijayamali Birch that you talked about, she was in a serious accident. She nearly died. Part of her vertebrae were crushed. And she was in the hospital, and they tried a procedure in New Zealand, and that procedure was not working. And they said, well, just be still for 24 hours. And she was dying. She said, on the one hand, I thought I was going to die. On the other hand, I said I better push myself into the next morning. And the other part of her, all of a sudden, another part said, you don't have to make it to the morning. You just have to make it through this moment, and this moment, and this moment. And when we bring ourselves into the present moment, we are able to be instead of being caught in all of those different experiences. And when we're able to do that, then we can begin to take charge of of chronic pain, even chronic pain. One of my students had neuropathy, and she was in pain. But what happened is, by taking this class, by meditating, by learning to be mindful in the moment, her pain was reduced, and she was able to look at her emotions that were ramping up this experience, and she was able to look at her thoughts. Because all of those, I'm in so much pain, I feel terrible, I'm going to lose my relationships, I'm going to lose my job. All of those things keep increasing our pain. And one of the most important models of pain, the Gateway model, model says it's impossible for anybody to have pure sensations of pain. It always is accompanied by these others.
Very interesting, Richard. Yeah, our mind always complicates the pain problem, that we have. We try to teach for the person to come into the present moment and to avoid these emotional reactions, and the pain would go way down. It may go away altogether. It might just be little. It might be a 2 instead of an 8 or a 10.
That's right.
I saw 4 patients like that today. And their histories were so complex. And multiple spinal operations, 21 injections. I saw a patient recently had 82 injections by a family doctor. Then she went to another pain doctor, and they injected her 10 times each. Then they addicted her to drugs. And then she went to see another pain doctor, injected her 21 times. She came to see me. She was curled up in a little ball on the table. 13 MRIs in 5 years, and I looked at the MRIs, didn't show a lot, degenerative disc disease, and my opening words to her was, and what's going on in your life? And you know what she said? I lost my child in an accident 5 years ago. Yeah, this is the patient I saw a few months ago. I saw a patient today, it was the same darn thing. It was a child. She lost a child.
Yes.
And she's overeating, gaining a lot of weight, developing a chronic pain problem, and she finally just had it. She said, narcotics don't work, I'm going to stop them and teach me how to get rid of them, which is not easy. Some of them are so addicted. She was on morphine. She had cut her fentanyl patch in half, but couldn't go beyond that, and she might need some of the long-term addictive drug Suboxone to finally get off of that, which might take even another year. So pain medication, is part of that. I don't know if any of you saw that article in U.S. News maybe 3 weeks ago, where a general confessed being addicted to narcotics. He also said 1/3 of the people in this U.S. Southern Op Command, Special Ops Command, 1/3 of the patients had seen a physician for a pain problem in the U.S. Southern Special Ops Command were addicted to narcotics. Yes. Unbelievable. He said, I wonder if Al-Qaeda is defeating us at home and not abroad. So this is the reason I make these DVDs. It's a heck of a problem out there. Tell us, this is very interesting, this NBSR, because stress is a great deal of pain, and that's why people take the medication.
Yes.
So we can, and they cause mind-body illnesses, which I'll speak about a little later too. It's not the only thing they cause is pain. Other things, atypical chest pain, headaches, rashes,
Yes.
irritable bowel. These are all stress-related, what I call mind-body illnesses. But now tell us, we have another program at the Mind-Body Institute. Tell us a little bit about mindfully based chronic pain management. Tell us about that a little bit. This is a course you're going to be running. And what do you have in mind to do there, Richard?
Well, the two are related because they're both mindfulness-based. And a physician in Toronto, Jackie Gardner-Nix, went to work with John Kabat-Zinn. And her population in Toronto is people in chronic pain. So she adapted Dr. Kabat-Zinn's approach specifically to people with chronic pain. Both programs work with chronic pain.
Yeah.
They both do that, and both are proven through research. One of the most important things about this is we're not just talking about it. There are
scientific proof
hundreds of articles.
What we're talking about.
Yes,
here.
it's extremely well established. For example, Kabat-Zinn in his study, he did a study of a 1 year follow-up of those with chronic pain in MBSR, mindfulness-based stress reduction, and there was a 72% reported moderate to great reduction in pain. So some people, you're not going to say they're going to get rid of all of their pain, but moderate to great after a year. So that's not just placebo because that lasts. So what Jackie Gardner-Nix does is she makes the program a little bit shorter. Per hour. She does 10 2-hour classes, and that's what I would be doing in the mindfulness-based chronic pain management. But in the mindfulness-based stress reduction, that's an 8-week class for 2.5 hours per class, and then that one also includes a day-long retreat. The same approach overall. It's really about the population, because mindfulness-based stress reduction can be for anybody who's got stress. Which is a lot of people. The chronic pain one is focusing on people who have chronic pain.
Strictly a pain problem. Because we treat 75% of the patients see a physician, have a physical presentation of stress. 75%.
Right.
So the mindfulness-based stress reduction would be ideal for them, as well as the pain people. But when you think about it, the majority of people see a physician, need a coach. They need coaching. They don't need needles, operations, and narcotics. We could save a tremendous amount of medical care, much safer and a lot cheaper. Tremendous reduction.
Save so much money.
In cost. What we are doing here, Richard, is attaching the brain back to the human body.
Right.
Descartes cut it off the head in 1635, gave the brain to the church and the body to science and medicine.
Right.
We've not reattached the human brain to the body. This is really, what we're doing. And so mindfulness really, the way I look at it, let me tell you how I look at it, is focusing on the moment. We both agree on that. On the present moment, not the future, not the past, not that I got surgery tomorrow, right now, what's going on right now. And this also involves quite a bit in teaching meditation, doesn't it?
Yes, it does.
Meditation brings us into the present moment. If you can't quiet your mind, use a mantra, that's mind energy to quiet your mind, and related to breathing techniques, paying attention to your breath. Could you explain a minute, what's meditation about anyway?
Well, you said one of the most important parts in what we're doing. In meditation, we're seeking to still the mind. We're seeking to bring us to a point where we're focused on the breath, and even if I'm focused on the breath, and I've got to go buy some food, bring it back. So what we're doing is we're training the mind. An untrained mind is a mind in pain. A trained mind can handle it. There's the power of the mind is incredible, but often we don't apply that. So we have sitting meditation. We're also teaching people to walk, which means I can begin to move and meditate. We have something called the body scan, which is a lying down meditation, and people focus on one part of the body at a time. And it's again teaching focus. Mostly the mind is not focused, and the more focused the mind is, the more powerful it is. And we're looking to bring all of us together through that. We also do mindful yoga, because that's movement. We're learning to move. And when I'm mindful when I move, I begin to take that into my life. Washing the dishes, driving.
Washing the dishes is meditation, isn't
Yes,
it, Richard?
yes.
As long as you're looking at the flowers and the form of the spoons, that's really meditation because it's concentration.
You're living
And
right here, right now.
right now. So we can meditate at home, doing the dishes for the children at night. That's really meditation. As long as you pay really attention to what's going on. When I'm washing my hands, doing surgery,
Whatever.
to me, it's really meditation before I start the operation. I even visualize what I'm going to do.
Yes.
It's much more likely to happen.
Yes.
That's really part of meditation too.
It is.
If you visualize while you're meditating, it's much more likely to happen in your life.
Yes.
Because your subconscious brain reacts to visualization. To form a visual picture, a movie or something you're going to do, really brings it much more likely to reality.
But that's what successful people have always done.
The successful golfers, what do? They visualize their shot.
Right.
They're not thinking how to hit the ball from here to there. They're visualizing it when they step up to hit that ball because they practiced the shot long ago. It's automatic.
You know,
So,
Phil Jackson, the great basketball coach, realized that some of his players were not very focused, and so he brought mindfulness-based stress reduction trainers into first the Chicago Bulls and
Did he really?
LA.
Yeah.
And what was interesting is that, of course, somebody like Michael Jordan. He didn't need that. He's already a master because when you are an athlete, you got to be in the moment. You can't say, what should I do here when I'm making a layup? You can't do that.
It's too late.
You're totally into it. That's why the physical actions are so important. Or in surgery, you can't say, gosh, I don't know what I'm doing here. I've got to think of this. It's you develop a way where your body and your mind are working as one, and when you do that, then you're successful.
Yeah. You know, I read a story once about Jim Thorpe, the great athlete, you know, and as they go into Europe in the Olympics in 1938 or somewhere in there, he was on and the rest of the team was working out on the ship and everything. Jim Thorpe, I mean, we don't recommend this. Jim Thorpe never worked out at all. You know what he's doing? He sat in the corner and he visualized every event that he's going to do from beginning to end, from putting his feet down to running, everything how was going to happen. You know what happened? He almost won every event.
I know. Well, he was already a great athlete. He was
power of the human mind.
Yes.
So mindfulness really is stripping off the baggage. Get rid of the baggage.
Yes.
Don't dress up the pain problem.
Get down to the essential. What's real here?
Yeah.
Right now.
No past, no future.
Right.
Don't dress it up.
Yes.
The bare facts, isn't
That's
it? And mindfulness is mirror thought, isn't it? I mean, it's your thought bouncing back at you the way it actually is, without dressing it up.
It's very realistic.
It's very realistic.
People think, meditation, that's all airy-fairy. No, it's very realistic. You're living right here realistically in the moment.
Yeah. We spoke about the breath and the breathing, to pay attention to your breath from the air coming through your nostril to your diaphragm, relaxing. That really improves your concentration.
Yes.
And it's elemental. It related to the prana, the energy, of the universe.
It is prana.
Right. And meditation brings in tranquility, awareness, concentration, insight. So mindfulness is mirror thought. Your thoughts are bouncing right off the mirror. It's non-judgmental. No judgment.
Key.
It's just a fact. It's just a fact. And we already talked about walking meditation. You can meditate while you walk.
Absolutely.
Whatever
we're doing.
Whatever you're doing, you can do it. And the body scan you spoke about already. And I even recommend this for cancer treatments. When people have a cancer somewhere, to visualize that the cancer, say a chemotherapeutic agent is coming in and destroying the cancer, and they're urinating the cancer out, or a Pac-Man comes in, is eating up the cancer, and they're getting rid of the cancer. Because your mind can affect your immunity.
Whatever visualization works for that person.
Your mind can speak to your white cells.
Oh, yes.
So we recommend it even for cancer treatment. And visualization, we spoke about it. Very important to visualize. Visualize your future. Visualize getting rid of this pain, that the pain is leaving your body. If you visualize that through meditation, it very well could happen.
And another thing I would add that I really like from Herbert Benson is visualizing being aware of your inner doctor, your inner healer. Because when I'm aware of that, I can only go to a doctor so much. But if I'm inside myself and I'm saying, I am getting better, I am getting strength here, the power of intention, the power of positive thinking, all of those have an impact right down to the cells, and it's proven.
Yeah, I've read that also, and I think maybe Kabat-Zinn's book about you developing a thought process of having a healer. You visualize the healer,
Yes.
and then deal with the modalities that we'll be speaking about. And I just want to mention a little bit some of the things we put together. Here we have 7 or 8 DVDs on chronic pain, which I've been giving to my patients, duplicating them. They're available at the Mind Body Institute. They're all talks about the treatment of chronic pain. First, explaining pain. I have one called The Fraud of Chronic Pain, because I think it's a bit of a fooler. I mean, chronic pain doesn't tell us where the trouble is. It doesn't. We have pain, but it just doesn't point to any one part of the body. So to me, it's a fraud. And then I talk a little bit about people taking advantage of that and doing too much to us. So it's about seven or 8 DVDs I put together that really explain the problem, and it also includes your mindfulness teaching course, Dr. Johnson's teaching course, and the holistic treatments of chronic pain we were talking about today. I'm going to also do a DVD on addiction, because a lot of people entering the pain thing here come to us addicted to medication. So I want to address that, what it does to your brain and how to get rid of it, and how to avoid it. Number 1 is how to avoid it. Number 2, how to get rid of it. So we're going to have a nice DVD on that. I also have in there the DVD on nocebo, the evil twin, negative speak, how providers will use negative speak about your studies to convince you to have something done for maybe what they're looking at. The MRI, which is abnormal in every living human being except little children, they don't use it as an excuse to do something to you. So I have a book called Nocebo, the Evil Twin, Richard. You'll love that book. 50 pages, easy to read. How to avoid medical procedures. Very good. It's part of that. And then another tape really explaining pain in more detail. It's called Acute and Chronic Pain. I want everyone to understand. You have to understand what it's all about if you're going to change. So I think once a person will watch the 7 hours of speaking about these things, I think people will know what this is all about. But when you add it all up, what's that versus an operation? $20,000 operation or $100,000 hospital bill versus knowledge.
Education, so we know what the problem is, because most people don't
education.
know what the problem is.
I've even recently, that journal I was talking about is going to present this to the physicians in the U.S. Army because they have so much addiction trouble. Let's talk about wellness treatments here a little bit. Massage therapy, for example, is used quite frequently. Why does massage work? I tell you why massage works, and I highly recommend it for chronic pain, because the massage impulse is much faster to the brain than a pain impulse. A pain impulse stops at the spinal cord level, is modulated and changed. That's the gate theory of chronic pain, which we explain in one of the tapes. And it's slower. And there's slow fibers in, but the touch fibers, the massage fibers, get to the brain much quicker, and you feel better. That's why massaging is great. Acupressure is another way of massaging. Very excellent. I recommended recently to an older person some acupressure, and it solves their problem. And look how easy. No risk, no addiction, no risk. And the physiology of it, we just explained that it's a much faster impulse. Reiki, what does Reiki mean? We hear the word chi, which means energy. It's also prana, means energy, just in Japanese. Reiki, chi, more in Chinese. Reiki, really the key is chi. So Reiki is a way of laying on 2 hands for treatment. Say for headaches, you hold your head with 2 hands like that, but you can do it by yourself, actually. Lay it on your chest or lay it on your extremities, or someone can do it to you. And there's about 3 levels of Reiki, and they're practitioners in that, and I think that's an excellent form of treatment for chronic pain. So if you have headache trouble, we'll have someone on the staff who will be available to use Reiki for the treatment of chronic pain. Reflexology is another method of treatment for chronic pain, where they massage the feet, and there are maps and certain pressure points on the feet, and it can be done to the hands, incidentally, too. And they, through the Asian form of medical thinking, will go through the meridians. For example, you can massage the feet and affect the liver and the spleen and stomach. If you don't believe that, I tell you honestly, it does work. when you think 75% of the people that I look at, all they need is a coach, you can see why coaching and massaging and reflexology indeed has value. Gets a lot of people well. Look at how little risk there's involved with it. And we already spoke about acupressure and pressure points and the energy, the chi they talk about in the universe. What's the chi? What's the prana? It's subatomic life force that was present before the formation of the earth. And you see even in ancient cultures, Hinduism, in China, thousands of years ago, 5,000 to 10,000 years ago, they write and they speak about the life force, the chi, and they walk along meridians in the body. They've never been anatomically demonstrated, but they sure as heck get a lot of people well by pushing energy and chi up these meridians through massaging, through acupressure, through acupuncture. That's how acupuncture works, is through these energy lines, these meridians. And then they also speak about the chakras. You've heard about that. The crown chakra, the forehead, the throat chakra, the chest one, the heart one, the pelvic one, the sacral one. These are centers of energy. And some, for example, Reiki is practiced on some of these chakras. This is actually the Reiki position. There's two hands, and they press on these chakras and really heal an awful lot of people. This can be done for pain. But let's move on a little bit. And exercise, of course, is something we highly recommend. It's available at the Mind Body Institute for all types of yoga, from mild to medium to severe. And we'll talk about yoga in a little bit. And at this point, Jacklyn, with us here today, is an instructor in Pilates. And I tell you, I truly believe in it. She's going to explain to us a little bit about the history of it and what she does. And I was sitting in a restaurant recently, and a gentleman I've known for many years does Pilates 4 days a week. And I tell you, he looked like a movie star. He looked like a movie star. And he said, that's the only thing I do, and I'm going to do it the rest of my life. And he practices it seriously. And he says, I'm perfectly healthy. He was perfect weight and health mentally, physically. Yeah, I think he means it. And I really think it's going to be true. I think it's going to be true. So I'm very excited about hearing a little bit, to expand my knowledge a little bit, Jacklyn, about Pilates. So give us the history and tell us a little bit about what you do.
All right. Well, Pilates was developed by Joseph H. Pilates back in the early 20th centuries. When he first developed it, it was actually called controlology, which goes along with a lot of what we've been talking about. Just using the mind in order to control the muscles was what his main focus was on. Back when Joseph was a little boy, he suffered from rickets as well as asthma and just a poor respiratory system. So that's what started his interest in the body. And he set a time and he learned how the body works, and he spent the time to learn how to strengthen not only his body but his mind as well, because he believed that the two of those together did make a huge difference, just like we've been talking about. He developed this exercise system to help train athletes, and not only did he help train them, but he helped rehabilitate them as well. So it's actually something that you can use as a form of rehabilitation, which is nice, which means that it can be done at any age, any skill level, from children to adults back to the elderly, as well as beginners to a more advanced. There are different types of Pilates that have developed throughout the years. There's a more classical style and a contemporary style. The classical style is the original work of Joseph Pilates. Most of his teachings can go back directly to him or one of his proteges. And they have also the contemporary, which is the original, only each original move is broken down, and they do changes, modifications in order to make it safer or harder for people that like a little bit more of a challenge. At Cashman, I teach a more contemporary style, meaning that it's different exercises depending on the class. I also teach a Pilates pump class for people that want a little bit more cardio. And I also designed a class that you can do all on an exercise ball. It's a Pilates class, which helps work on the core a little bit more, which is the main focus in Pilates. A lot that we've been talking about is just how much the mind needs to be connected with the body. And that's what Pilates is. The whole time that you're doing it, you're supposed to be focusing with your mind on the move and what you're doing with your body. And it helps you to get to know your body a lot more.
Very interesting. So really the mind, like most even yoga activity, is to really to concentrate on the body part that you're moving. Mm-hmm. Now the classes you have, you probably have different degrees. Huh? You have some for elderly or people that aren't in too good a shape, and ones that really go at it and really have a heck of a workout, right? There's all degrees of it.
Oh yeah, we get a very different, doing it at the Institute, we get a lot of different type of clients.
And some people are probably flying through the room.
Oh yeah. And then there's the others that you kind of have to throw them across the room too.
Very interesting. Do you play music with them at all?
I do. It just really depends on the day. We do, we'll listen to the traditional meditative music, or we can listen to something like jazz. It just depends on the class and the people in it. I kind of let them decide what they want to listen to.
Very interesting. Is this along my line of thinking? If that's all a person ever did in terms of exercise and things, they'd probably live to be 100, be perfectly healthy, get rid of most illnesses, get to be of normal weight, and it's a wellness program, isn't it?
Oh, yeah, definitely.
And you could, frankly, get a person over a chronic pain problem. And I love your statement about the core. I mean, what are most of the backaches that I see in the office? They're about the core. It's sarcopenia, it's called, sarcopenia. And women who get almost 50% get compression fractures page age 60. And everybody thinks the calcium in the bones. Mm-hmm. It's the muscles. Richard, it's the muscles. Something I learned recently, and we should have known from the beginning, is that we can increase our muscle mass 200 to 300% into our 90s.
I read that.
And so what should we treating when we see a 70-year-old person come to see us with a backache? Strengthen the core. Strengthen the core. These calcium pills and things, they don't work very well. They get major complications too. Mm-hmm. What works? Strengthen the core. I really appreciate you elucidating our thought process about it a little bit, and I'm going to attend your next class because I do a lot of the yoga activities. But this is just great, and thanks so much for coming and educating the audience. And Richard and I a little bit about Pilates.
I appreciate it.
A wonderful thing for a person to do. Thanks so much.
I'll be expecting you in there too then.
Richard does a lot of these already, and I'm going to join him. And this is just great. Thanks so much.
Well, thank you guys.
Thank you so much. And with that, Richard, tell us a little bit about yoga. I mean, we hear the term yoga all the time, and I'd like to have your thoughts on it, which is readily available at our Mind Body Institute. We have a lot of classes in this, but elucidate the audience in this a little bit, Richard.
Well, sure. First of all, yoga is an ancient practice, and it's done first in India, but it's done all over the world. There's 15 to 20 million people in the United States practicing yoga right now. So it's widely done.
Well, that's a huge number.
There are different forms of yoga. In the United States, most people know about hatha yoga, which is the physical postures that we're doing. But in the classic yoga system, there's hatha yoga, the physical focus. There's also Raja Yoga, which is mental focus. That's the first one I learned. There's Bhakti Yoga, which is the yoga of devotion or of spiritual longing. There's Agni Yoga, which is the yoga of fire. And the Kundalini Yoga is a part of that. I want to say be very careful with the Kundalini, because some people mess with that and they can burn their own bodies. It's not, you should always have a very good teacher about anything that you're doing, but especially Kundalini. So yoga by its nature means union, just like yoke. It's
Yeah,
related
that's the
to
term yoga I've mentioned.
Yeah.
You're really uniting the mind. You're uniting the mind with the body, aren't you? Really?
Yes, you are.
And this is the purpose of it, and that's the healing of it. Really,
Yes.
you're trying to connect the mind, the body, and the spirit.
Right.
That's what yoga is really all about.
Right.
Yoga is meditation.
Yes,
really.
it
When
is.
you have yoga activity, you pay
Meditation,
attention to every
and motion.
movement.
Right, absolutely.
You pay attention to every movement, and that's really a form of meditation because you're concentrating in this movement, and people get get a lot looser because it's stretching. Mind control is part of yoga, and there are many different forms of yoga. And at the Mind Body Institute, we have mild, and moderate, and severe forms, and there's many different forms of it. Tai Chi is a form of yoga, which it goes back 5,000 years. And the Chinese invented this. It goes back thousands of years, and it's mind, body, spirit. They talk about the essence, the energy, and the spirit. This is Asian way of thinking in terms of medicine, and of moving the energy, the qi, through the body. And Tai Chi, these are very slow, controlled movements where you concentrate the movements. This is Tai Chi. If you go to China, you see them doing it all the time.
Millions.
I went to Hong Kong. I got up at 6 in the morning, and it was the most beautiful day. I was staying at the Marriott in at the Hilton. I was at the Hilton, and I was there for the opening of AOL in China, actually. And the door opened up, and this beautifully dressed Chinese gentleman in a white suit, with a big smile on his face at 6 in the morning, and just like Norman Vincent Peale, it says, "Isn't this the most beautiful day you ever saw?" I said, "Do you like your job?" He says, "I love my job. I look forward to it every day." It was beautiful. Then outside the hotel, what are they doing? They're doing Qigong. And I think a few were doing Tai Chi. What's Tai Chi compared to Qigong? Tai Chi is the martial arts of Qigong. In other words, really, Tai Chi is a defense mechanism. They use it to protect themselves, for example. I mean, the moves are a lot tougher. So they start with Qigong, and then it turns into martial arts, and you're doing Tai Chi.
Yes.
Both are beautiful. Of course, both are about control of your mind.
Yes.
They're about control of your mind. They're about the essence, the spirit, and the energy.
Yes.
And to go back to the primordial energy. Remember I said the primordial subatomic energy.
The life force itself.
The life force.
Yes.
Before atomic energy and atoms in the world were discovered, this life force is the belief of the Chinese, Indians, Japanese, that this was present in the universe, the prana, that you and I feel each other, that we can almost feel what you're thinking, which is true between all human beings.
Yes.
And this is what they really speak about. Of course, wellness is also about. Did you want to add something, Richard?
Well, just to bring it back to the issue of chronic pain.
Yeah.
The chronic pain is an imbalance in energy.
Yeah.
And when our energy is imbalanced, we have trouble. I had back pain. I had chronic back pain. I used the mindfulness-based stress reduction, which teaches yoga, and then I take yoga from one of the teachers at the Cashman Institute, Shao, and there are several movements that I can do now that I couldn't do before, and there are things that I do that are toning, strengthening, and stretching my back in conjunction with the life force. Twice a day, for example, I do a gentle twist in my back. And that is like going to the chiropractor. I hear, I just bring my back into shape, and that gives me so much health. Twice a day, that's 700 times a year. Let's say if I were to go to a chiropractor that amount of time, that would be very expensive. But I can do it at home, so that I'm making myself healthier at home. Now, all action that we do, whether it's exercise, whether it's Pilates, has a risk. We can hurt ourselves, but what it does is it teaches us about our own bodies. And when we know how our bodies work, then we're not so subject to chronic pain, because chronic pain is usually in a part of the body or even the whole body. But if I'm beginning to feel the chi, if I'm beginning to feel the prana moving through me, then I'm able to tune into health in a completely different way.
Yeah. I teach this to patients constantly to make them more mindful. I'm just using an example of my own neck pain, and which I got from practicing. I play a lot of tennis, looking upwards all the time, and I was practicing a new twist serve, and boy, I got a pretty good neck pain out of it. And it's been there about 3-4 months, but I'm really mindful about it. You know what I mean?
Yes.
I do exercise every day. I do some lifting to build up the musculature of my neck.
Yeah.
The thing is about going away, and I took about a Tylenol, and that's all I went to. I didn't try to sensitize my brain with a narcotic. I could easily have taken a narcotic. You know, I didn't even get an X-ray. You know why I didn't get an X-ray? I didn't want to see that X-ray because I might start obsessing about it. The visualization of it. There's a doctor walking down the hall, and I've been following him for 3-4 years. He keeps on showing me his new MRI that he got of his neck, and he's looking at the picture. What do you think, Rudy? Is it time for surgery or not? You see, he's got the visualization of it.
Nocebo.
The nocebo of it, and he's really making it worse.
Yeah.
I didn't want to say anything about it, but he's making it worse. I'm going to get an X-ray if I'm dying from the pain. Fine, you got a pain down the arm, and I'm walking around like this. I'll get an X-ray. But just for a neck pain, I'm not going to get an X-ray. Once I see the visualization, what do you think my brain's going to do? I'm going to drown in the pain. I'm going to obsess about the pain, talk about the pain, and make it worse. So I'm trying to be mindful about it. And every morning in the shower, I do some basic neck exercises and treat it like that. I'd like to mention a little bit about the diet. I think all pain problems you really should eat a nutrient-based diet, which we teach at the Mind Body Institute. I have a diet class there. I'm a neurosurgeon. Why would I have diet classes there? Because there's so many patients with a chronic backache who are overweight and come in with an MRI that looks abnormal, and they want me to do an operation. Certainly, if they need it, I'm a surgeon. Believe me, get paid more for surgery than talking to people. Well, handing out DVDs, which a lot of times I don't get paid for. But still, I'm trying to get them well. So I teach an awful lot of diet. I know a lot about it. If this is part of your pain problem, I have 5 books out called The Magic 5. Motivation to Proper Eating, Psychology of Eating, Secret of the Non-Diet for Adults, Secret of the Non-Diet for Children, and Reversing Type 2 Diabetes in 60 days, 90% of the time. That's the magic. Isn't that magic?
That's
that
wonderful.
Is magic.
That's wonderful.
And so proper eating is part of a pain problem. I mean, if you're a nervous eater and just gaining weight and gaining weight and gaining weight, your pain is not going to get better. You're hanging more weight onto your pain problem. So how do I look at pain problems, Richard? I look at them as a wellness thing.
Yes.
I had 3 or 4 patients like that today, and I said, we're going to work on wellness. Now, I'll be honest with you, I spent a lot of time with them, 30 minutes each, although I was extremely busy, and we gave each other a hug at the end, and I think we're going to make them better, because and a number of these are very tough problems. You know, many previous surgeries, many narcotics, some on morphine, and one I think will even need maybe Suboxone in the end, because she's, I think, addicted to the medication. And that will take, a lot more education, and I may speak about this a little bit. So the Chinese, talk about the essence, the energy, the spirit, moving the chi around the body, the prana, the life force. And other treatments, holistic treatments alike, is music, laughter, the arts.
Oh, yeah.
And I give a talk on once a year on music and healing. I think music is critical. I was just on vacation about 10 days in Florida, and experimenting. I like music to begin with, and as a child, actually, I played at Carnegie Hall. I wasn't any good, but my music school got me there. And I'm walking down the beach for an hour. You love this, Rich. I played tennis 2 hours in the morning, walked the beach for an hour, and I got me a headset, and I put some beautiful music into it, and walking. Boy, that makes you feel better, Richard. It makes you feel better. So there weren't too many people out there one day, and I know that conductors are the ones that live the longest. Yeah, you always wonder why that happens. You know what I started doing, Richard? Conducting the music. And I felt better.
Sure.
Then another 2 days go by, and a couple of songs that were doing, some of the John Lennon songs, and I knew the words. Richard, I started singing. And I felt even better. So music is healing.
It is.
Your music. After a stressful day, I get in the car, I have it pre-recorded, I hit that button, 30 seconds. 30 seconds. I'm living in a different world. It's meditation. And,
It is.
and music goes to our amphibian brain in evolution. You know, we had the amphibian brain, the limbic brain, now we get the cerebral cortex. But it goes to our primitive brain and secretes, I think it hits the nucleus accumbens, and secretes dopamine, the feel-good stuff. And we feel a lot better. One day, somebody I knew was driving behind me, called me, I was telling me, "What are you doing, Doc?" And they saw me conducting the music. So I really highly recommend music for healing and laughter. You know, Norman Cousins wrote a book, a famous book because he was having a spinal pain, and it's really worth reading.
I love his books.
Because he would watch funny movies and have no pain for 6 hours. So even funny movies work real good, and very distracting. And dopamine and serotonin are the feel-good hormones. How do you get them secreted? Exercise secretes them. Laughter secretes them. Food secretes them. Well, you got to watch what you eat. You know, and you want to proceed with a glass of wine because then you got a license to eat everything. So you have to watch that. We also teach Zumba dancing at the Mind Body Institute to bring dancing in there. One time we had a Dancing with the Stars, and that was a lot of fun. So I think to learn to dance or do Zumba dancing is a craze across the country, and we offer that. And I think it's very helpful for the mind, the body, the energy.
Huge weight loss too.
And good for obviously good for weight loss. And I like to mention a little bit and maybe talk a little bit here about the mind-body connection. About the mind-body connection,
yes.
Because this is very important. Now, Doctor, why do you feel the stuff you're teaching here works? I'll tell you something. Descartes in 1635 wrote a famous book, Discourse on stripping the extraneous material of the real facts. This is really what he taught. So to look at the pure facts of things, that's mindfulness, isn't it? He wrote his famous book. I have that book, actually, believe it or not, in my library at home. And he cut the head off the body, handed the head to the church and the body to science. So for 300 years, we've been working on this body, forgetting this attached to the human body. I'm afraid to say most of medicine is still the same way. They don't teach mind-body medicine at medical school level. I hate to say, Richard, but sometimes I feel like they should hand out engineering degrees to doctors. They're engineers. We need to reattach this to the head.
That's what we're doing.
It's starting to start, but at medical level, I've been down there. They're reluctant. We have no time. That's the reason you see so many procedures, when we need to talk to people a bit. We need to talk. The public knows it. The public fully understands it. But I don't understand why our professors at the medical school level don't seem to understand.
They're not being mindful.
They're not really being mindful. So how does the brain speak to the body? This is what's interesting. Our brain secretes neuropeptides. These are proteins made in the limbic system, hypothalamic system, and they land on receptor sites on our cells. Candace Pert wrote a very famous book, and the name of his book is called Molecules of Emotion, 1972. Read that book. Easy to read, very good book. I've met her. She's at Georgetown even. She's a neurophysiologist, and she's at Georgetown University. And she is the first one to describe the opiate receptor sites on the human cell, these little receptors that stick up. This is where medicines work. We make our own morphine, endorphins. We make our own morphine. You ain't got to take it. We make it. How do you get it out there? Meditation, breathing techniques. Why does Lamaze work? Lamaze work? It's because of this. Lamaze works because of our thought process. So our brain speaks to our body. But our white cells also make all these neuropeptides that the brain speaks to the body. Our white cells make them too. So our white cells, our immune cells, can speak to our brain. So it's body, so it's brain, body, body, mind. It's a complete loop. So how we think affects the whole body.
Oh, absolutely.
You get up in the morning, your thought process is going to affect your 70 trillion cells. If you wake up mad, your cells are mad. Thank you so very much for listening. to our lecture on chronic pain. Richard, thank you very much.
My pleasure.
And I'd like you to look at our multiple DVDs and CDs, maybe participate in some programs of the Mind Body Institute, and we can get you over your chronic pain problem and maybe help your mind-body diseases without a lot of injections, without a lot of surgery, save you a lot of money. And we're going to get you to live to be 100, to be of sound mind and a healthy body. And with that, Richard, thank you very much.
Thank you.
Wasn't this a lot of fun? Namaste.
Namaste.